If you have spinal stenosis and you've been doing exercises to manage your pain, that's a good start. But here's something you need to understand right now because it could be the reason your back and leg pain keeps coming back. There is one very common mistake that most stenosis patients make, and it continues to drive symptoms even after doing exercises and even after doing treatments. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas, and I've worked with many patients dealing with spinal stenosis in both the lower back and neck. In this video, you're going to learn exactly what that mistake is, why it prevents your symptoms from fully improving, and what you need to start doing differently if you want more lasting results. And make sure you stay until the end because I'm going to show you one specific thing you can start doing today that targets the underlying reason your stenosis keeps returning. And if you want to learn more about spinal health and structural correction, subscribe to my channel, tap the notification bell, and like this video so you don't miss future updates that can help you make better decisions about your spine. To understand why this mistake is such a problem, you first need a clear picture of what's actually happening inside of your spine. Your spinal canal is the space that runs through the vertebrae, and it's where your spinal cord and your nerve roots travel. In a healthy spine, there's enough room in that canal for the nerves to function without pressure. Spinal stenosis means that space has become narrowed. When that narrowing happens, it puts pressure on the spinal cord and the nerves, which can lead to symptoms like pain, numbness, tingling, and weakness that can travel to the arms or the legs, depending on the location. This can happen in the lower back, which is lumbar stenosis, or in the neck, which is cervical stenosis. The narrowing itself can come from disc bulging, bone spurs, thickened ligaments, or a combination of these changes over time. Here's the part most people don't realize. The canal is already limited in space, which means everything you do with your body, from how you sit to how you exercise, is either helping create more room or making that space even tighter. Once you see that clearly, it becomes much easier to understand why the wrong movements can keep your symptoms going. Now that you understand what is happening inside of the spine, the mistake becomes much easier to see. The number one mistake stenosis patients make is not that they avoid exercise. It's that they're doing the wrong type of exercise for their condition. And in many cases, those movements are actually making the narrowing worse. A lot of these exercises fall into a category called extension. This is when you arch your spine backward, like in cobra stretch, back extensions, or certain McKenzie style exercises. You also see this in very common exercises like standing back bends, prone press-ups, supermans, and even certain yoga poses like upward dog. Some people are also doing bridges or aggressive back extensions on a stability ball, which can push the spine into the same extended position if not done carefully. For some conditions, especially certain disc issues, those movements can be useful in the right context. The problem is that spinal stenosis works very differently. When you extend your spine, the space in the back of the spinal canal becomes smaller. That means less room for the spinal cord and nerves. If your canal is already narrowed, that pushes you further into the wrong direction. This is where a lot of patients get stuck. They're doing the exercises that are supposed to help, but instead of those movements are adding pressure to an already tight space. There are two main reasons this happens so often. One is the exercises designed for disc problems are often given to stenosis patients, even though the mechanics are not the same. The other is most people are focused on short-term relief. They do an exercise, the pain eases for a short period, and it feels like progress. Then the pain comes back and the cycle repeats. That pattern can go on and on for months or even years without actually fixing the underlying issue. Exercise itself is not the problem. The problem is applying the wrong movement to the wrong condition, which keeps your spine moving in a direction that continues to compress the canal instead of creating space. Once you see that, the focus has to shift. The goal is not just to reduce pain for a short period of time. The goal is to consistently create more space inside the spinal canal. That starts with underlying mechanics. Spinal stenosis is a space problem, which means every movement you do needs to be evaluated through a simple filter. Is this creating more room in the canal, or is it compressing it further? For most lumbar stenosis patients, that means moving toward controlled flexion. This is when the spine gently rounds forward, which helps open up the back part of the canal and reduce pressure on the nerves. Simple movements like sitting and leaning slightly forward, bringing your chest towards your knees, can create that space. Needed chest movements while lying on your back can also help, along with gentle pelvic tilts that encourage the spine to move out of that extended position. These are not aggressive movements. They're controlled and intentional. The goal is not to force motion, but to guide the spine into a position that reduces compression. You should always pay attention to your symptoms and stop any movement that clearly makes them worse. At the same time, this is where many people need to think beyond exercise alone. Stenosis develops over time as the structure of the spine changes. Disc height can reduce, alignment can shift, and the natural curves of the spine can become altered. If that underlying structure is not addressed, then even the right exercises may only provide partial or temporary relief. This is where approaches like non-surgical spinal decompression and structural correction come into play, because they're designed to reduce pressure in the canal and address the mechanical cause, not just the symptoms. And this leads into a critical piece, because even when patients start doing the right things, there's one factor that determines whether they actually see lasting results or end up right back where they started. Even when most patients start doing the right exercises, this is where things often fall apart. They feel some relief after a few days or a couple of weeks, and they assume the problem's handled, so they stop. Then the symptoms return, sometimes worse than before, and the cycle starts all over again. This pattern keeps people stuck for months or even years. If you're working with a chiropractor or physical therapist, it's important to stay consistent with your program and not abandon it too early. Make sure you're discussing your progress, your results, and any changes in symptoms so your care can be adjusted appropriately. Real change with spinal stenosis requires consistency over time, because you're not just calming symptoms, you're working to change the mechanics of the spine through repeated, focused effort. At this point, if you have lumbar stenosis, you're heading in one of two directions. The first path is what most people do. You use general exercises that give short-term relief, you feel a bit better, then you stop. Then the pain comes back once, daily activity puts pressure on your spine again. That cycle repeats over and over, often leads to injections or surgery without ever addressing the actual narrowing in the canal. The second path is a more targeted, more complete approach. You focus on movements that help open the spinal canal and reduce pressure on the nerves, and you stay consistent even when symptoms improve. As part of the approach, you work with a chiropractor who understands spinal stenosis and focuses on improving spinal mechanics, not just temporary pain relief. This path also includes spinal decompression, which is designed to reduce pressure within the discs and help create more space in the canal, something that directly supports better outcomes for stenosis when combined with the right exercise. Now, the first step is not adding more exercises. The first step is taking a closer look at what you're already doing. Write down every exercise you're currently doing for spinal stenosis, and then ask one simple question. Is this movement creating more space in my spine, or is it compressing it? If an exercise involves arching your lower back, extending your spine, or pushing into a backward position, it needs to be looked at very carefully. In many cases, those are the exact movements keeping your symptoms going. Before you add anything new, start by removing what's working against you. That alone can begin to change how your spine responds. This is where real progress starts. When you understand the mechanics, apply the right exercises, and stay consistent, you give your body the chance to improve in a meaningful way. If you want to learn more about spinal stenosis and how to approach it in the right way, subscribe to the channel, tap the notification bell, and like this video so you don't miss future updates. If you want to see these flexion-based lumbar stenosis exercises demonstrated step by step, watch this video next. I'll show you how to do them safely so you can create more space for your spine, reduce leg pain and weakness, and move with better strength and stability. Go watch this video next.